Calling the Health and Human Services Committee hearing on the deferred decision-making agenda for SB 760 relating to psychologists and SB 2049 relating to psychologists. This meeting will include that deferred decision-making agenda, the 101 decision-making agenda for SB 2259 with proposed SD1, and the 1 p.m. Health and Human Services agenda. Present with me is my Vice Chair, Senator Aquino. We also have Senator Shimabukuro and Senator Keoho Kalole. This meeting is being streamed live on YouTube. In the unlikely event that we have to abruptly, and we have Senator Awa. In the unlikely event that we have to abruptly end this hearing due to technical difficulties, the committee will reconvene to discuss any outstanding business at 1 p.m. January 31st, conference room 225 and via video conference. For those on Zoom land, your audio will be muted and video disabled until shortly before it's your turn to testify. Each testifier will have 1 minute to testify. If there is a technical glitch during your time to testify, we may have to move on to the next person due to time constraints. I'll be reading a list of individuals who submitted written testimony for each measure. We apologize if the closed captioning does not accurately transcribe the names. If you're interested in reviewing the written testimony, please go to the legislator's website. You will find a link on the status page for the measure. We appreciate your understanding and remind you that the committee does have your testimony, that I have reviewed them. So I encourage you to use your time, your 1 minute time wisely, and to either add additional comments or stand on your written testimony because we do end, we are required to end by 2:30 today. Okay, thank you very much. So first up, for the deferred decision-making for SB 760 relating to psychologists and SB 2049, Chair's recommendation at this time is for SB 760 is to defer decision-making on that until the next hearing because we are still awaiting more definitive definitions for what a black box is from the Department of Health. And for SB 2049, Chair's recommendation is to defer that indefinitely. So now we are going to go into the 101 decision-making agenda for SB 2259. For SB 2259, I would like to, we're going to insert the contents into SD1 of SB 2259. Which requires each employer, group health policy, contract plan or agreement, and each individual and group hospital or medical service plan, policy, contract, or agreement issued or renewed by health insurers in the state after December 31, 2024, that provides coverage to provide coverage for dental and vision preventive care, diagnosis, and treatment, requires every insurer and mutual benefit society to provide written notice to policyholders and members no later than December 31, 2025. I would like to make a recommendation to insert the proposed substantive provisions of the Senate draft SD1 that can be found on the Capitol website and recommit the short form bill back to Health and Human Services Committee for further consideration. Senator Aquino for the vote. Chair votes aye.
Sure. Okay, thank you very much. Chair's recommendation is to pass Senate Bill 2259 with the proposed Senate Draft 1 amendments and recommit the short form back to the HHS committee. Okay, Chair votes aye. Vice Chair votes aye. Senator Keokolole.
Aye.
Senator Shimabukuro.
Aye.
Senator Awa.
Aye.
Recommendation is adopted, Chair.
Okay, thank you very much. Now we are going to move on to the 1 p.m. calendar. Thank you very much, Senator Aquino. First up is SB 2538 relating to the Department of Health, requires the Department of Health to provide prioritized funding for programs and services under its jurisdiction and fill vacant positions on the island of Molokai, requires a report to the legislature. First up, Department of Health providing comments. Please proceed.
Courtney Matsu, Medical Director and Acting Administrator for Adult Mental Health Division. The Department of Health stands on its written testimony and supports the intent of this measure to ensure access to mental health care and suicide prevention on Moloka'i. Our written testimony provides details regarding our current staffing as well as proposals to partner with the FQHC and the Moloka'i Native Hawaiian Health Program to implement a suicide prevention program grounded in Native Hawaiian cultural healing practices. We're here to answer any questions. Thank you for your time.
Okay, thank you very much. Next, we have the County Council of Hawaii Chair Alice Lee in support. Next, we have John Oliver, Department of Health, Maui, providing comments on Zoom. Dr. Oliver, please proceed. You're on, Dr. Oliver. Please unmute yourself. Thank you.
Aloha, my name is John Oliver, and I am the Public Health Program Manager and the Service Area Administrator for Maui County under Adult Mental Health Division. And I also support this bill as far as to increase services to better serve our Moloka'i community.
Okay, thank you very much. Next, we have Kenneth Favorito, a late testimony in support. Next, we have Luann Mahiki Langford Favorito, also in support. And that's all. Anybody else wishing to testify on SB 2538? Members, any questions? Okay, seeing none, moving on. SB 2918. Relating to State Health Planning and Development Agency appropriates the function of the State Health Planning and Developmental Agency with Department of Health, declares the general fund expenditure is exceeded and establishes positions. First up, we have Dr. Lewin. Come on up in support.
Hello. Thank you, Madam Chairperson and members of the committee. Appreciate this. You know, Hawaii really needs to have more health oversight of healthcare services than we currently enjoy and have today. Healthcare is a very complicated topic, and obviously it's more and more important because of the costs of healthcare, which we mentioned in our testimony, going from $4.6 trillion nationally to $7 trillion. That would be $50,000 per a family of four at the end of that time. It's getting to be very important that we start looking at healthcare costs, quality of care, access, equity, and all the important issues there. And we need some oversight to do that. SHPTA was created in 1975, nearly 50 years ago. And at the time of its creation, it had 65 staff and a large multi-million-dollar budget. I do not know what happened over those years, but the organization really kind of is focused on setting facilities plans and certificate of need.
Thank you. Your time is up, and we have two other bills. That's
Okay, well,
very
thank you. We
similar
really
measures.
appreciate your entertaining this bill. We think we can do a lot to really improve healthcare services and lead towards universal access in Hawaii.
Thank you very much.
Mahalo.
Next, we have State Council on Developmental Disabilities in support. Thank you very much. Next, we have Department of Human Services in support. Next, we have Healthcare Association of Hawaii providing comments. Paige, please proceed.
Hi, Chair, thank you. Excuse me, I'm not in person and I'm losing my voice, but we'll just then stand on our submitted testimony, submitting comments. Thank you.
Okay, thank you very much. Next, we have Don Cariso of HMSA in support. We have Hawaii Health Information Exchange in support, Francis Chan. Next, we have Health Association of Health Plans in support. Next, we have Eric Abe, Hawaii Primary Care Association in support. Next, we have, excuse me, 2918. I think that's basically it. Anybody else wishing to testify on SB 2918? Okay, seeing none. Members, any questions? Okay, I have a question of Dr. Lewin. Could you come on up? So Dr. Lewin, there's two other bills that's very similar. Which of the three bills do you want?
2285 was the first, and we believe that one is probably the one we should use as the ongoing vehicle.
Okay, thank you very much. Okay, any other questions, members? Okay, seeing none, moving on. SB 3129, relating to healthcare task force, Hui Ho'omana, State Health Planning and Development Agency established the Hui Ho'omana Task Force within SHPTA to develop comprehensive plan to provide universal access to equitable and affordable high-quality healthcare for state residents, including defining action plan items, setting timeline, deadline for each action item, and identifying resources required and funding. First up, Jack Lewin, Dr. Lewin in support. Please proceed.
Chair and honorable members of the committee. It's been really quite a long time since the state has really undertaken a careful assessment of the future of healthcare in Hawaii. We're at a place where states need to do this because the federal government is not positioning itself. The Congress has not taken decided not to take these kinds of issues on at this time. So it's very important for us to take some leadership here. And as you know, our state has done this in the past. We believe this task force, with its broad representation, will offer the legislature, the governor, and the health sector of Hawaii some great insights into where and how we should proceed in the future. So we hope you'll help us with this. It isn't a finance issue with the bill, but we believe it could be a very, very powerful, helpful measure for us.
Okay, thank you very much, Dr. Lewin. Next, we have Insurance Division, Gordon Ito in support. Thank you, Dr. Gordon Ito. Okay, next we have State Council on Developmental Disabilities and support. Okay, thank you very much. Department of Human Services and support. Hawaii American Nurses Association in support. Please proceed.
Good afternoon. My name is BJ Bartleson. I'm a representative of the Hawaii American Nurses Association, speaking for over 16,000 RNs who work and live in Hawaii. And to be clear, we are not to be confused with our colleagues at the Hawaii Nurses Association, HNAOPIU, Local 50, who represent bargaining issues. Hawaii RNs represent the largest number of providers in our healthcare system, and we see firsthand the financial disparities that cause inequitable access to healthcare services, leading to avoidable mortality and morbidity. We support the bill concept. However, we respectfully request amendment to SB 3129, Section 2 to require Hawaii American Nurses Association Executive Director or their designee to participate as a voting member on the Hui Ho'omana Task Force. Thank you for your attention to this matter.
Okay, thank you very much. Next, we have AARP in support. Please proceed.
Good afternoon, Senator, members of the committee. I'm Audrey Suga Nakagawa. I'm the Advocacy Director for AARP. AARP stands on its testimony in support of this measure, and we are very honored to be invited to be one of the task force members and participating in this goal of trying to improve the access to healthcare coverage. While Hawaii has one of the best healthcare coverage in the country, we know it's still far from being perfect. And there are still a lot of gap groups who are struggling to have affordable healthcare. One of the examples that I like to point out is that our family caregivers, those who are not 65 yet, would have sometimes quit their jobs and lose their healthcare coverage. And then they're really in a mess and trying to provide care for their loved one, but not having their own healthcare coverage. So these are some of the situations that we hope that this task force will try to address and improve. The only other thing that I like to point out is that if we could request an amendment on the legislation, it's regarding our name. We are no longer called the American Association of Retired Personnel. You can just keep it to AARP, and that would be great. So thank you very much for testifying in support of this measure.
Thank you very much. Next is University of Hawaii, Lee Wenhensei in support, Hawaii Association of Health Plans in support, Hawaii Primary Care Association, Eric Abe in support, Queens Health Systems, JC in support, okay? HMSA, Don Kurisu in support, Michael Robinson, Hawaii Pacific Health in support.
Actually, Senator, we provided comments. And,
oh, you're right, comments, sorry.
Part of this committee. Thank you.
Okay, thank you very much. And we have Healthcare Association of Hawaii providing comments.
Thank you. We'll stand on our submitted comments and do appreciate being named to this group. Thank you.
Okay, thank you very much. Next, we have Jonathan Chin, Kaiser Permanente, providing comments. Anybody else wishing to testify on SB 3129? Okay, members, any questions? Okay, I have questions. Dr. Lewin, why don't you come on up? Okay, so you had testified earlier, and not testified, in writing, that there are already a number of advisory groups, 4 new advisory groups that are gathering information, expert community-based, neighbor island input. So why do you need this?
Thank you for this question, Madam Chair. These groups formed specifically to help us, advise us around a grant from the federal government that the MedQuest Division and SHPTA on behalf of the governor are applying for. It's called AHEAD. It would bring hundreds of millions of dollars of support services for primary care and for improvements in the healthcare system. So the groups were formed to help populate that, but their information will be very useful. They will be wrapping up their services later this spring, but we think that the information they've gathered will be helpful to the task force and its deliberations.
Okay, so we're back to why do you need a task force when you already have the information from all these other groups?
They're not as comprehensive as the kind of report that we hope to submit to you at the end of the work of the task force.
Okay, my other question, why do you need a bill? Why don't you just create your own task force? Don't you already have the authority to do that?
We do, but we think this adds some interesting weight and perspective to it, having come from the legislature, and actually then we hope the report is something useful to this body.
Okay, so with that, you, according to this bill, you want to have 2 reports. One within 20 days prior to the legislative session, and the next after the legislative session, because it's after, we can't really do anything about it, but it's going to be dissolved thereafter. Do you have any problems with us just requiring 1 report?
No, we can. We'll be fine with that. We'll try to get as much as we can to you. As long as the task force could come back and take responses to your comments and maybe act on them before its last submission.
Okay, before dissolution on July
Yes.
1, 2025.
Mhm.
Okay, second, there is Hawai'i nurses, Hawai'i ANA wants to replace your number 7, Hawai'i Nurses Association. Do you have any problems with that?
No, we think that's appropriate.
Okay. Okay, thank you very much.
Thank you.
And I also want to point out that Catherine Davis also wrote testimony in support. So did Beth Gisting and Marilyn Seeley also in support. Wesley Sumida also in support. Leimomi Khan in support. Michael Older in support. Anybody else wishing to testify on SB 3129? Any questions, members? 3129. Okay, seeing none, moving on. SB 2462. This is similar to the previous bill. First up, we have State Council on Developmental Disabilities in support. Thank you. Next, we have Dr. Lewin again in support.
Share my testimony.
And your prior testimony.
My prior testimony.
Thank you very much. Okay, and Director Betts, Department of Human Services in support, HMSA in support, Hawaii Association of Health Plans in support, Francis Chan, Hawaii Health Information Exchange in support, Hawaii Primary Care Association, Eric Abe in support, Healthcare Association of Hawaii providing comments. Paige, proceed.
We'll stand on our comments that are similar to what we submitted for SB 2918. Thank you, Chair.
Okay, thank you very much. Anybody else? Which we have Catherine Davis in support. We have Beth Gisting in support. And we have Wesley Sumida in support. Anybody else wishing to testify on SB 2462? Members, any questions? Seeing none, moving on. SB 2285, the first one of the trifecta. First up, we have, okay, again, relating to State Health Planning and Developmental Agency. amends the functions, appropriates money. First up, we have SB 2285. We have Dr. Lewin in support.
Stand by previous testimony. Thank you.
Thank you very much. Next, we have State Council on Developmental Disabilities in support. Okay, thank you very much. Department of Human Services in support. Dr. Lewin again a third time in support. Okay, thank you. Francis Chan, Hawaii Health Information Exchange in support. Eric Abe, Hawaii Primary Care Association in support. HMSA in support. Hawaii Association of Health Plans in support. Healthcare Association of Hawaii, comments. Paige.
Thank you, Chair. Thank you. And if this is the bill that's going to become the vehicle going forward, do just really want to emphasize our comments regarding adding providers into the discussion about any state global budgets. We think that's a really important piece of that discussion. So if this does become the vehicle, we just want to note that in our comments. Thank you so much.
Okay, thank you very much. Okay, anybody else wishing to testify in SB 2285? Seeing none, okay, I just want to point out, we also have Francis, oh, we did say Francis Chan. Catherine Davis in support, Beat Geesting in support, Wesley Samita in support, late testimony from Melvin Sakurai in support. Anybody else wishing to testify in SB 2285? Okay, members, any questions? Seeing none. Okay, moving on, SB 2467. Regarding oh, I'm sorry. Okay, sorry. There was SB 3137, excuse me, relating to mental health services for children and adolescents, amends the statutes pertaining to mental health services for children and adolescents provided by CAMD to reflect the current mental health systems of care that address intensive mental health needs of children. So for SB 2137, I received no 3137. I received no testimony. Oh, we do have somebody. Okay. Governor's package, I would think you would testify. So please identify yourself and please proceed.
Aloha, Chair, Vice Chair, and committee members. My name is Kaylee Aquaro. I'm the Acting Administrator for the Child and Adolescent Mental Health Division of the Department of Health. I apologize, we had a technical error. I do have the testimony here if you would like to.
Yeah, what, do you have enough for everybody?
I do not, I'm sorry.
Okay, so late testimony. Okay, why don't you got 40
Okay.
seconds. You need to read it out loud.
Sure. Well, I will just say that the statute that governs what the Child and Adolescent Mental Health Division does is 50 years old. And so we strongly support updating it to reflect our current practice. Since 50 years ago, when we were a branch of the Adult Mental Health Division, there's been significant research demonstrating that child and adolescent mental health is a specialty and distinct from adult mental health, and therefore should be its own division. I'm available if anyone has questions about this update.
Okay. Any comments? Anybody else wishing to testify in SB 3137? Seeing none, any questions? Members on 3137? Okay, Melody, you have 1 minute.
Angela Melody Young cares in strong support. So the Hawaii Children and Youth, the annual conference for keikis across the state, said that this year the Hawaii's children, what matters to them is one, more resources for tutors and counselors to improve education and mental health resources at school. And two, they said they'd like Hawaii schools to have a class to educate students about the importance of mental health issues. And of course, I'd like to show honor to the original co-founders of Hawaii Children and Youth and the Keiki Caucus, Susie Chan Oakland and Uncle Dennis Arakaki. A shout out to them and their work that has perpetuated into this generation. And at the federal level, the U.S. Health and Human Services released a new national guidelines for improving youth mental health crisis care, which helps communities address gaps in care. And this generation has a lot of gaps.
Thank you.
Thank you.
Anybody else wishing to testify on SB 3137? Members, any questions? So Department of Health, come on up again, since there's a super late testimony. Doesn't look like you're asking for any appropriation.
That is correct. We are not.
Okay, sounds good. Any other questions? Seeing none, we're moving on. SB 2467. First up, this relating to Hawaii State Hospital. Appropriates funds to the Department of Health to implement quality improvement measures recommended by the Comprehensive Safety Review of the Hawaii State Hospital. Declares that the general fund expenditure ceiling is exceeded. Please proceed. Identify yourself. Please proceed.
Aloha, good afternoon. Chair Sen Buenaventura, Vice Chair Aquino, Senator Keoho Kalole, and Senator Shimabukuro. Thank you for allowing me to testify. My name is Kenneth Luke. I'm the administrator of Hawaii State Hospital, which is part of the Department of Health. The Department of Health stands by its written testimony in support of Senate Bill 2467. This measure will allow our hospital to make some much needed safety and quality improvements. I'm happy to answer any questions. Thank you.
Okay, thank you very much. Okay, anybody, SB 2467, we have Louis Urchik, Hawaii Disability Rights Center in support. And we have, hold on. Alan Urasaki in support. Anybody else wishing to testify on SB 2467? Seeing none, members, any questions? So I do. Mr. Luke, come on up. It looks like a lot of what you are requesting sounds reasonable. The installation of cameras, metal detector ones, urinalysis, reinforced entry. Have you made this request as part of the Department of Health budget? All of these monies?
I have not.
Second question, why is this not part of the governor's package?
You
didn't make it in time?
We're going to ask that way too, Chair.
Okay, come on up. Marian Suji.
Marian Suji, Deputy Director for Behavioral Health for the Department of Health. This incident that occurred at the state hospital occurred and the research that was done afterwards all occurred after the governor's budget had been submitted. So there will be an emergency appropriation requested
in addition to this.
Okay. But we do really appreciate the support that we received on this.
Okay, and the reason I'm asking is I don't want the governor to veto it because it wasn't part of his budget. Okay, so we want to make sure it's not duplicative.
Yes.
Okay, thank you. Any other questions? Okay, seeing none, moving on. SB 3143, another making an emergency appropriation to Department of Health for asbestos remediation to temporarily relocate the Department of Health offices and begin preliminary planning for the redevelopment of Kinauhale site. Department of Health, first up, in support.
Good afternoon, Chair, members of the committee. Lauren Kim, Policy Director for the Department of Health. We're going to stand on our written testimony in support. Asbestos disturbances have become more frequent. Per HIOSH and independent testing, air quality is still safe. However, out of an abundance of caution, we're asking for an emergency appropriation just in case something happens. We would like to ask for an amendment, and with your permission, I can send it to the exact wording to your committee clerk to Section 4, which is the appropriation, to allow any appropriation authorized by the legislature to be used for relocation. That's what's currently there. And we would like to add preliminary redevelopment planning and asbestos remediation activities as allowable activities for any appropriation that's given. Thank you, and we're available for questions.
Okay. Any other questions for, excuse me?
I have a question, Chair.
Okay, please proceed.
Why wasn't this one put in the budget?
So we are putting a governor's message through for the next fiscal year that reflects all of the rationale in this emergency appropriation. It started with 1 asbestos disturbance, then it was 2, then it was 3. And we are still working with DAGs and contractors to figure out what needs to get done. And so we don't have a firm plan now, but out of an abundance of caution, we'd like to have funds available just in case.
I guess, but you hit something just recently that stimulated this need. I mean,
yeah.
I think if I was an employee in Kinohale, I sure would like to know what necessitated this emergency need for asbestos remediation.
Good afternoon, Val Cato, First Deputy Director, Department of Health. We've been having more and more incidences. And so there was one that happened right around Thanksgiving. And as a result, we've conducted air quality testing on every single floor of Kinohale, and it's come back with the air is safe. Everything is safe. However, because these incidences continue to come up with more and more frequency, we have a concern that there could be failure of the building. And if there's a failure of the building, we will not be able to quickly find alternative space.
Understood. Thanksgiving sounds like an emergency appropriation timeline. Thank you. Thank you, Chair.
Stick around. Any other questions, members? Okay. Your written testimony, Mr. Kim, asked for, well,
5 million.
5 million. But then somewhere here, your bill
is 1.5.
Is 1.5. So I think you testified that you wanted flexibility because you guys keep finding more stuff. Is that it? And relocation?
Well, certainly whatever is appropriated, the existing language in Section 4 is insufficient. So that would allow more activities such as relocation and redevelopment planning.
It says relocation.
Oh, yeah, relocation on top of relocation, preliminary planning for redevelopment and remediation. We want to make sure we have legal authority to expend funds for those
preliminary planning for redevelopment
of Kinohale parcel.
And remediation.
Remediation for asbestos. I can get you the exact wording to the clerk right after this hearing. But
the decision making is happening now.
Understood.
Okay.
But in terms of the discrepancy in the amounts, it's really been a moving target. And as much as we've had consultants and DAGs take a look at it, we really haven't gotten a sense of an exact figure. But so we think at a minimum $1.5 million would be sufficient just to evacuate staff. We store temperature controlled vaccines in the building, and that needs to be accounted for. So I think at a minimum 1.5.
And there might be some temporary remediation, things that we might be able to do better. We have looped in HIOSH, who is looking at the issue. And so that amount we think would be sufficient in the near term in order to get any kind of remediation done.
So, I mean, Senator Keohana pointed this out. There are people in that building.
Yeah, relocate, not evacuate.
Right, yeah, relocate.
Are they safe now?
Yes. We have conducted testing on every single floor, and we are committed to redoing testing. Safe. Yes.
Okay.
So there's been, I think, 3 rounds of testing.
They've been 3 rounds of testing. And so
are you folks in that building?
Yes.
Yes.
Okay. Okay, thank you very much.
Thank you.
Any other questions? Okay, seeing none, do we need to recess for decision making? You folks good?
Good.
Okay, we're gonna proceed with decision making. You have everything? Okay, so for SB 2538, Chair's recommendation is to pass with amendments. Amendments are, we're gonna remove the word prioritize on page 2, lines 4 and 20. We're gonna add a section for blank appropriation for a suicide prevention program grounded in Native Hawaiian cultural healing. We're gonna insert in the committee report the Department of Health's request for additional positions as stated on page 2, lines 21 to 23 of their testimony. Any comments, questions, concerns? Seeing none, Vice Chair for the vote.
Okay, Chair.
Chair votes aye.
Okay, Vice Chair votes aye. Senator Keokulole.
Aye.
Senator Shimabukuro.
Aye.
Senator Alba.
Aye.
Recommendation is adopted, Chair.
Okay, so for SB 2918, pursuant to Dr. Lewin's and a number of people's testimony, we're gonna defer that in lieu of SB number 2285. So for SB 3129, we are gonna pass SB 3129 with amendments. We're gonna replace on number 7, the existing proposed member with Hawaii ANA Executive Director or nominee. We're going to amend the reference to American Association of Retired Persons to AARP. We're gonna remove on page 7 the word preliminary on line 19 and remove on page 8 the phrase the conclusion of the reported of the regular session of 2025 and replace it with its dissolution. And any other technical amendments recommended by SMA. We're also gonna put in a defect date because of the amendment of December 31, 2050. Any comments, questions, concerns? Seeing none, Vice Chair for the vote.
Okay, all members are present. Any reservations? Any noes? Recommendation is adopted, Chair.
Okay, for SB 2462, same recommendation as 2918. We're gonna defer that for 2285. So SB 2285, we're gonna pass this with amendments. We're gonna add to line 8, page 1, the sentence healthcare includes oral health, behavioral health, and long-term care, period. We're gonna add a effective date of December 31, 2050. And that's it. Any comments, questions, concerns? Seeing none, Vice Chair for the vote.
Okay, all members are present. Any reservations? Any noes? Recommendation is adopted, Chair.
Okay, for SD 3137. We're gonna pass that with amendments. We're gonna add in the tech amendments that SMA recommends. And otherwise, no other amendments. Any comments, questions, concerns? Seeing none, Vice Chair for the vote.
Okay, all members are present. Any reservations? Any noes? Recommendation is adopted, Chair.
Okay, for SB 2467. We're gonna pass this with amendments. We're gonna insert Department of Health's appropriation request in the committee report, including the equipment, the reinforcing of the entry and exit points, the increased staffing, and the support of $10 million requested. Any comments, questions, and concerns? Seeing none, Vice Chair for the vote.
Okay, all members are present. Any reservations? Any noes? Recommendation is adopted, Chair.
Okay, so for the last one, SB 3143, Chair's recommendation is to pass this with amendments. We're gonna remove the $1.5 million on page 3 and make that a blank appropriation. We're gonna insert after on 13, instead remove the period and including preliminary planning for redevelopment and remediation. And we're gonna and add in a defective date because it sounds like it's a moving target, so may need to go to conference. And add in the committee report, the Department of Health's request stated in their testimony of purchasing equipment for new cameras, upgrading PA systems, metal detector ones, urinalysis testing, and supplies of $920,000. Excuse me, sorry. and adding in, delete that, that was for the prior bill. Adding in the committee report, the $5 million general fund appropriation as needed by Department of Health for the relocation of staff and equipment due to asbestos disturbance, as well as beginning preliminary planning for the redevelopment of the parcel of Kinauhale and any remediation as needed. Any comments, questions, concerns? Seeing none, Vice Chair for the vote, Chair votes aye.
Okay, all members are present. Any reservations? Any noes? Recommendation is adopted, Chair.
Thank you. Okay, from the 1 p.m. calendar, where the HHS deferred agenda, I think I said this before, but just to confirm that we are going to defer decision-making on SB 760 to Wednesday, 1 p.m. on January 31st. Okay. Any other comments, questions, concerns? No? We are adjourned. Thank